Welcome back. Dr. Samia Benslimane with Shannon Medical Center, also a cardiology vein clinic, is here with us. How are you doing?
I'm good. How are you?
Well, I'm fine, thank you. You know, this is the time of year when people start to lose everything after winter. Yeah. We've been covered up with tights and long sleeves and long pants and everything else.
That's
and
exactly right.
You know, we're looking at everything now. Tell us about what spider veins are. We've all heard about it, but I'm not sure everybody knows what that is.
Yes. So spider veins, usually most people notice them on their legs, and it's little tiny fine veins that are on the superficial part of the skin. There's also a reticular vein, which is a little bit deeper, sort of a lighter blue vein that's underneath the spider veins, or can be. That's typically what people notice on their legs usually. They can be elsewhere, but the legs are where people are most noticed them.
Is there any certain age more prevalent in men or women? Are there any, what kind of similarities do you see with people who have them?
Yes, definitely more prevalent in women, mainly because of pregnancies. Big risk factor for getting them is pregnancy. Also, it can be hereditary, so if your mother has had them, that's generally passed down as well. And then age, they tend to develop more as you get older. A lot of that's just gravity has caused the veins to get a little bit dilated, plump, and more visible. Also, as you get older, the skin gets just a little bit thinner. So those are generally the main risk factors for getting them.
All right, so what do you do if you think I need to have something checked, or I'm not sure if it's a dangerous thing or not, or would just like to have them removed? What do you do?
Yes, so this is a cosmetic procedure. Generally, it's patients who are asymptomatic. They don't feel anything. They just don't like the way that it looks. So come into our office, give the clinic a call, we'll get you set up, take a look at them, see if you're a candidate or not. There's a few exclusion criteria, but generally most patients qualify for it. And it's an intra-office procedure. It's strictly for cosmetic purposes, just to make you feel better and look a little bit better. It takes about 15-20 minutes. Really no restrictions once it's done. The main thing is just avoiding the sun for 2 weeks, or anything that darkens the skin. Tanning bed, tanning lotion. You do want to avoid that for 2 weeks.
For scarring, I would assume.
Correct. You don't want the skin to darken with this procedure. You want to let it stay light and bright. But otherwise, you can go back to your regular activities and just go about your day.
Well, what about working out or riding bicycles or doing all that?
Working out is great for it, particularly walking, running, jogging, and bicycle. Anything that causes your legs to move squeezes the blood out of your legs, the muscles do, and that gets the blood out of your legs, which helps the procedure actually be more successful. So exercise is great. Also good for prevention as well.
All right, really quickly, one more time, if you're a candidate, you think you are, what's the first step to take?
Just call Shannon. The operator can plug you into the cardiology clinic. We'll set you up with an appointment, do a consultation, and see if you're a candidate and get you taken care of then and there.
All right, is this a busy time of year for you? Always.
Always.
Always. Every single day,
Always.
I'm sure.
Always.
Well, thank you for taking the time to visit us this afternoon.
Thank you so much.
It's nice to see you. Dr. Samia Benslimane. We're going to take a look outside and see what's going on. Beautiful clear skies across the Concho Valley. Beautiful spring day. Randy's in next with the latest on the forecast.
This portion of the news sponsored by Concho Valley Foundation Repair.